Millions of older adults receive regular medical screenings each year, confident they're making optimal health choices. But what if certain routine examinations could actually increase stroke danger within days? This revelation may initially sound impossible. You have complete faith in your physician. You diligently follow all medical advice. However, within modern healthcare's intricate framework lie concealed hazards that seldom get discussed. These threats don't make headlines or appear in medical brochures. Even healthcare professionals may not always recognize them fully. Consider this situation. You finish your annual physical feeling assured everything appears excellent. Then within days you experience dizziness, visual disturbances, or more severe symptoms. You wonder what could have gone wrong. The truth is, specific diagnostic procedures can silently cause unexpected blood pressure surges, disrupt blood flow, and potentially trigger cascading effects resulting in stroke. This becomes especially worrisome when examinations happen too often or involve patients with pre-existing medical conditions. Stay calm. This knowledge isn't intended to frighten you. Rather, it's meant to help you pose better questions to safeguard yourself and family members. Beyond age 60, early identification alone isn't enough. We must also prevent creating issues we previously didn't have. Over the next several minutes, we'll explore 5 common diagnostic examinations that pose hidden stroke dangers for elderly patients. Most crucially, you'll acquire vital information to protect yourself before your next medical visit. Comment 1 if you're above 60, or 0 if younger. Please follow Senior Health for insights others won't provide. If you're viewing now, show understanding by commenting 1 if this makes sense, or 0 if not. Also share your country in comments. We'd appreciate connecting with you. Let's start with the first examination requiring careful consideration if you've experienced CT scanning with contrast materials. You may recall that warm, spreading feeling throughout your body. The contrast substance helps doctors visualize blood vessels, organs, and tissues with greater clarity. Sounds helpful, correct? Here's what numerous seniors never discover. That small injection can accomplish far more than improve image quality. When you're past 60 with current high blood pressure, cardiac conditions, or kidney issues, it can quietly strain your cardiovascular system. The contrast material sometimes causes vasovagal responses in certain individuals, resulting in dramatic reductions in heart rate and blood pressure. This can create lightheadedness, nausea, fainting, or brief unconsciousness. Sometimes the reverse occurs instead. Fragile blood vessels may contract or spasm from sudden blood pressure elevations. When this happens, stroke or heart event possibilities slowly increase. Research published in the Journal of Vascular and Interventional Radiology discovered that elderly adults undergoing contrast-enhanced CT scans had substantially higher vascular complication rates within 72 hours, particularly those with hypertension, cardiovascular disease, or kidney dysfunction backgrounds. Basically, the more fragile your system, the more hazardous that contrast agent becomes. Let me provide an actual example. An 81-year-old individual arrived for routine abdominal CT imaging due to minor digestive complaints. The scan revealed normal findings, so he departed feeling well. Nevertheless, he experienced a small stroke 2 days afterward. The probable cause? The contrast injection likely triggered temporary blood pressure elevation, causing clot development and blocked circulation to part of his brain. This doesn't suggest contrast-enhanced CT scans are inappropriate. In fact, they can preserve lives by identifying cancers, blood clots, and aneurysms. Here's the crucial point: don't arrange these scans routinely just to be cautious. They should be utilized appropriately. How can you safeguard yourself? Discuss with your doctor before accepting contrast CT scans. Inquire whether this scan is essential or if safer options exist for someone your age and health condition. Provide your complete medical background, particularly high blood pressure, kidney disease, heart problems, or previous negative reactions to contrast materials or medications. Always question if the procedure can be performed without contrast. Non-contrast CT scans or ultrasounds may supply sufficient information without extra risks. Next, we'll examine a screening frequently offered to seniors even when they're healthy, which may not be as secure as it seems. Let's discuss stress testing, also known as exercise stress examinations. Theoretically, they appear reasonable. You wear cardiac monitoring while walking on a treadmill to observe how your heart responds under pressure. However, if you're over 60, especially with high blood pressure or heart problems, this straightforward test could become hazardous. Here's the reason. During examination, you'll walk or potentially run on a treadmill while your heart rate receives continuous monitoring. As speed increases, your heart rate elevates, blood pressure rises, and your cardiovascular system suddenly encounters significant stress. This might not concern a healthy 30-year-old. But for older people, particularly those with existing conditions, it's like igniting a flame near dry tinder, potentially causing severe problems. What are the dangers? In uncommon but genuine cases, small ruptures can develop in delicate blood vessels, especially in the brain. Dangerous blood pressure spikes, unexpected arrhythmias, and irregular heartbeats are also possible. A 2020 American Journal of Cardiology study monitored over 1,300 individuals aged 65 plus who underwent treadmill stress testing. The findings? Approximately 7% of participants experienced negative effects like blood pressure spikes and irregular heart rhythms from the examination. Who was most impacted? Those with existing circulation difficulties. This isn't merely theoretical, it's actual life. Margaret from Ohio, one of our subscribers, shared her experience. She's 74 with long-term high blood pressure. Her physician recommended a stress test as a simple evaluation. Midway through the treadmill section, she started experiencing dizziness and chest pressure. They halted the test immediately, but she suffered a mild stroke the following day. Medical experts stated the sudden blood pressure increase during testing caused a small brain vessel to burst. To clarify, the test didn't directly trigger the stroke, but it stressed an already compromised system. That was the determining factor. What's the essential takeaway? Speak with your physician. Is there a safer method to assess my heart? Sometimes nuclear stress tests using medications to mimic exercise or resting echocardiograms might be preferable for seniors. Also, if you're not experiencing symptoms like chest pain, breathing problems, or fatigue, ask whether the test is absolutely required now or could be postponed. Next, we'll examine another frequently performed test that appears risk-free but may contain hidden dangers if you're not cautious. Our next subject is something extremely routine after age 60, endoscopy. Whether examining your esophagus, stomach, or colon, physicians often recommend these procedures for safety. Sometimes this makes complete sense. But here's what nobody explains. It might create more harm than benefit if you don't truly require it, especially when anesthesia is involved. First, most adults over 60 take certain medications. Common blood thinners include warfarin, aspirin, and Plavix. These are commonly prescribed. The anesthesia administered during endoscopy naturally impacts your blood pressure and circulation. Combined with medications that interfere with blood clotting capability, you suddenly face elevated risks for internal bleeding or worse, brain circulation issues leading to silent strokes. A 2021 comprehensive review in Gastrointestinal Endoscopy Journal identified a significant increase in transient ischemic attacks, TIAs, or mini-strokes, among patients 65 plus who underwent endoscopic procedures under sedation within the subsequent 72 hours. While these weren't major strokes, They were warning indicators that brain blood circulation had been interrupted. One case I recall involved a 76-year-old woman who underwent routine colonoscopy under anesthesia. She arrived without symptoms. But 2 days later, she began slurring speech and lost coordination. Emergency department staff confirmed she'd experienced a minor stroke. Physicians believed the blood pressure drop during sedation, combined with her regular aspirin usage, may have created ideal conditions for a blood clot to migrate. Though the procedure itself is relatively safe, the combination of sedation, age, and medications can create dangerous circumstances. This doesn't mean avoiding all endoscopies, but don't agree to one unless your physician clearly explains why you need it. Ask about monitoring your condition, especially if you're symptom-free or it's been years since your last one. Always inform your doctor about current medications. Do I need to discontinue my blood thinner beforehand? What are sedation risks for someone taking my medications? If you're worried about sedation, ask whether the procedure can be performed without it or if less invasive alternatives exist. Moving to our next subject, we'll examine another often overlooked examination involving something most of us never consider: the kidneys. MRIs are incredibly valuable tools. They can see deep within your body, identify early warning indicators, and sometimes prevent unnecessary surgeries. Where caution is required, particularly for elderly individuals and especially those with even mild kidney issues, is when contrast dye is added for enhanced images. MRI contrast dye often contains gadolinium, a heavy metal. It doesn't remain stable in the body, it's designed for kidney elimination. But here's the problem: kidney function naturally decreases between ages 60 to 70. If you have undiagnosed chronic kidney disease or impaired function, your body might not eliminate gadolinium as effectively as normal. Small amounts could remain longer. This persistence can be dangerous. Gadolinium retention is associated with nephrogenic systemic fibrosis, NSF, a rare but serious condition causing skin and connective tissues to stiffen and thicken. In severe cases, it can limit movement and breathing, potentially causing organ complications. Here's what most people don't realize: retained gadolinium has also been discovered in brain tissue. Some specialists believe it may cause subtle neurological symptoms like confusion, dizziness, and disorientation, especially in people already at risk for circulation problems. A 2019 Radiology Journal study followed over 2,000 people aged 65 plus who received contrast-enhanced MRI. About 5% reported stroke-like symptoms, headaches, vision problems, and balance difficulties within a week after the procedure. While these weren't complete strokes, they were warning signs. Most of these patients had underlying kidney problems, whether detected or not. Harold, a 79-year-old Arizona veteran, underwent an MRI for chronic back pain. His physician required contrast just to be safe. Harold wasn't aware his kidneys were compromised. Nearly a week after the scan, he continued experiencing dizziness, weakness, and mental confusion for 2 days. His primary care physician ran laboratory tests, only then discovering he had stage 3 kidney disease. He told us, "Nobody warned me. If I'd known, I would have asked more questions." Here's what you can do. If your physician suggests contrast MRI, ask if it can be done without contrast. Often the answer is yes. If contrast is absolutely necessary, request a kidney function test first. It's a simple blood test called GFR that can give you and your physician peace of mind. Also inform them if you've ever had unusual reactions to imaging tests before. Remember, the MRI itself isn't the problem. It's the additional chemical your body might not process correctly. With proper precautions, you can still get the answers you need without endangering your kidneys or brain. Let's move to our final subject, a test that seems completely harmless and even beneficial to perform regularly, but might be leading elderly people toward potentially dangerous surgeries they didn't need. Routine carotid artery ultrasound involves no needles, dyes, or loud equipment, just a few minutes of completely non-invasive examination. Seems like the perfect preventive test, right? Here's what most people over 60 don't know. If you have no symptoms and your physician is only ordering this scan for screening purposes, this simple examination might lead you towards surgery you never needed. Carotid arteries are the primary blood vessels supplying your brain. Like many body vessels, they can develop plaque over time. Small calcium or cholesterol deposits are very normal, especially as we age. However, not every plaque deposit requires removal. Often, monitoring is wiser than operating. Here's where problems can develop. Suppose you get the test and it shows some narrowing, perhaps 50% or 60%. Frightening, right? Now your primary physician refers you to a vascular surgeon, and suddenly you're told to consider procedures like carotid endarterectomy or stenting. But if you had no symptoms, no dizziness, vision changes, or weakness, these procedures might not help you much. Plus, they carry risks. A major New England Journal of Medicine study tracked over 3,000 elderly people with moderate carotid narrowing but no symptoms. Researchers found that surgery often didn't reduce stroke risk more than medication and lifestyle modifications. Additionally, a small percentage of surgical patients actually had strokes as direct results of the procedures, either during surgery or recovery. Helen, an 82-year-old from Pennsylvania, has a story that resonates deeply. She went for a checkup feeling completely well. Her physician wanted to be thorough. She had a carotid ultrasound showing 65% narrowing. Surgery was performed within weeks. Unfortunately, she had a small stroke during the procedure. She survived but now has partial right-side weakness. She told us, "I wish I'd known that doing nothing might have been safer." What should you do? If your physician recommends carotid ultrasound when you have no symptoms, ask, "What are we looking for, and what happens if we find something?" Make sure you understand whether the scan will change your treatment or just cause worry. If you're already taking blood pressure and cholesterol medications and living healthily, additional tests might not make much difference. Don't worry too much if you've already had a scan showing some narrowing. Instead of rushing into surgery, consider repeat scans for monitoring. Always get a second opinion before any vascular surgery. In conclusion, let me offer some practical guidance and a gentle reminder that your health responsibility lies with you. Here's the bottom line. Some tests are safer than others, but some aren't necessary. Our bodies respond differently, especially after 60. Things that seem routine, contrast dye, sedation, or scans, can have consequences we don't expect. A simple injection might spike your blood pressure. A reaction could be triggered during scanning. Even simple examinations can involve risks that could harm already vulnerable systems. That's why pausing, asking questions, and ensuring each test fits your specific health needs rather than just following checklists or protocols is important. Don't hesitate to speak up. Ask, "Is this really necessary? Can we explore safer alternatives?" Your medical history matters. Your opinion matters. Informed decisions lead to better outcomes and peace of mind. We believe every decision should be based on knowledge, not fear or routine. Comment 1. If you've ever felt strange after a scan or test, or witnessed a loved one experience something unexpected. Otherwise, comment 0. Let's share, connect, and educate each other. If watching this video made you feel more aware, in control, or curious, subscribe to Senior Health. If you're watching right now, let me know you agree. Comment 1 if this video resonates with you. If not, comment 0. We're here to uncover truth, ask tough questions, and always put your health first. Millions of elderly people undergo routine examinations yearly, thinking they're doing the right thing. But what if I told you some of these very tests could actually increase your stroke risk overnight? Sounds hard to believe, doesn't it? You trust your physician. You follow every recommendation. However, hidden in modern medicine's fine print are latent dangers no one warns you about. It's not in the news or clinic brochures. Even your doctor might not always know. Imagine leaving your annual exam feeling everything's great, only to experience dizziness, blurred vision, or worse just days later. Now you're wondering what happened. Here's the truth. Certain diagnostic procedures can subtly trigger unexpected blood pressure spikes, disrupt blood flow, and start chain reactions that might result in stroke, especially when tests are performed too frequently or with certain health conditions present. Don't worry though, this information isn't meant to frighten you. It's here so you can ask better questions to protect yourself and loved ones. After 60, it's not enough to just identify potential problems early. We need to avoid creating ones we might inadvertently cause. In the next few minutes, we'll discuss 5 common diagnostic tests that may have hidden stroke risks, particularly for elderly patients. Most importantly, you'll gain knowledge necessary to protect yourself before your next appointment. Comment 1 if you're over 60, or 0 if not. Subscribe to Senior Health. We'll provide information others won't tell you. If you're watching now, let me know you agree. Comment 1 if this video resonates, or 0 if not. Please mention your country in comments. We'd love to connect. Let's get started. First, let's discuss a test you should seriously consider if you've ever had a CT scan with contrast. You might remember that warm, flushing sensation spreading through your body. The contrast agent helps your doctor see blood vessels, organs, and tissues more clearly. Helpful, right? Here's what many seniors never learn: that tiny injection can do much more than improve images. When you're over 60 with high blood pressure, heart problems, or kidney troubles, it can quietly stress your cardiovascular system, especially with kidney problems. The contrast agent can cause vasovagal reactions in some people, characterized by dramatic heart rate and blood pressure drops. This may cause lightheadedness, nausea, fainting, or temporary unconsciousness. Sometimes the opposite happens. Vulnerable blood vessels might constrict or spasm from sudden blood pressure increases. When this occurs, stroke or cardiac event possibilities gradually increase. A Journal of Vascular and Interventional Radiology study found older adults undergoing contrast-enhanced CT scans had significantly higher vascular complication rates within 72 hours, especially those with hypertension, cardiovascular disease, or impaired kidney function histories. The more vulnerable your system, the more potentially harmful that contrast agent becomes. Let me describe a real scenario. An 81-year-old patient came for routine abdominal CT scanning after mild digestive discomfort. Normal scan results meant he went home feeling well. However, he experienced a short-term stroke 2 days later. Most likely reason? The contrast injection possibly caused temporary blood pressure increase, leading to clot formation and blocked blood supply to part of his brain. This doesn't mean contrast-enhanced CT scans are wrong. They can save lives by identifying cancers, blood clots, and aneurysms. Here's the key: don't schedule these scans routinely, just in case. They should be used appropriately. How can you protect yourself? Consult your doctor before agreeing to contrast CT scans. Ask if the scan is necessary or if safer alternatives exist for your age and health. Provide complete medical history, especially high blood pressure, kidney disease, heart problems, or adverse contrast dye or medication reaction histories. Always ask if the procedure can be done without contrast. Non-contrast CT scans or ultrasounds might provide sufficient detail without additional risk. Next, we'll discuss screening frequently given to seniors even when healthy, which may not be as harmless as it appears. Let's talk about stress tests, often called exercise stress tests. On paper, they seem prudent. You wear a heart monitor and walk on a treadmill to see how your heart reacts under pressure. However, if you're over 60, especially with high blood pressure or heart issues, this straightforward test could become dangerous. Here's why. You'll be encouraged to walk or jog on a treadmill while your heart rate is continuously monitored. As speed increases, heart rate rises, blood pressure climbs, and your cardiovascular system suddenly faces significant strain. This might not trouble a healthy 30-year-old. For elderly people, especially those with existing conditions, it's like starting a fire near dry brush, potentially causing major problems. What are the risks? In rare but real situations, small tears in delicate blood vessels, particularly in the brain, can occur. Dangerous blood pressure rises, unexpected arrhythmias, and irregular heartbeats are also possible. A 2020 American Journal of Cardiology study of over 1,300 people aged 65 plus who underwent treadmill stress tests found about 7% experienced adverse effects like blood pressure spikes and irregular heart rhythms from testing. Who was most severely affected? Those with existing circulation problems. This is more than theory, it's real life. Margaret from Ohio, one of our readers, shared her story. She's 74 with long-standing high blood pressure. Her doctor suggested a stress test as a simple check-in. Halfway through the treadmill portion, dizziness and chest tightness began. They quickly stopped the test, but she'd suffered a mild stroke by the next day. Medical professionals said the sudden blood pressure increase during examination caused a small brain vessel to burst. To clarify, the test didn't directly cause the stroke, but introduced stress to an already weak system. That was the deciding factor. What's the key takeaway? Talk with your doctor. Is there a safer method for assessing my heart? Sometimes nuclear stress tests using medication to simulate exercise, or resting echocardiograms, might be recommended for seniors. Also, if you're not experiencing symptoms like chest pain, shortness of breath, or fatigue, ask whether the test is definitely required now or could be postponed. Next, we'll discuss another commonly performed test that appears risk-free but may have hidden dangers if you're not careful. Our next topic is something extremely normal after 60, endoscopy. Whether examining your esophagus, stomach, or colon, doctors frequently recommend these for safety. Sometimes this makes perfect sense. But here's what nobody tells you. It might cause more harm than good if you don't truly need it, especially involving anesthesia. First, most adults over 60 take some medications. Common blood thinners include warfarin, aspirin, and Plavix, frequently used medications. Anesthesia given during endoscopy naturally shifts your blood pressure and circulation. Combined with medications interfering with blood clotting ability, you suddenly face higher risks for internal bleeding or worse, brain circulation difficulties leading to silent strokes. A 2021 comprehensive gastrointestinal endoscopy journal review found significant increases in transient ischemic attacks, TIAs, or mini-strokes, among patients 65 plus who had endoscopic procedures under sedation within the subsequent 72 hours. While these weren't major strokes, they were warning indicators that brain blood flow had been disrupted. One memorable case involved a 76-year-old woman who had routine colonoscopy under anesthesia. She arrived symptom-free. However, 2 days later, she began slurring words and lost coordination. Emergency room staff confirmed she'd suffered a minor stroke. Doctors believed the blood pressure dip during sedation, combined with regular aspirin use, may have created perfect conditions for blood clot movement. Though the procedure itself is relatively safe, the combination of sedation, age, and medications can create very dangerous situations. This doesn't mean avoiding all endoscopies, but don't consent unless your doctor clearly explains why you need one. Ask about monitoring your condition, especially if you're symptom-free or it's been years. Always tell your doctor about current medications. Do I need to stop my blood thinner beforehand? What are sedation risks for someone taking my medications? If you're concerned about sedation, ask whether the procedure can be performed without it or if less invasive alternatives exist. Moving to our next topic, we'll discuss another often overlooked examination involving something most of us never consider: kidneys. MRIs are extremely useful tools. They can see deep inside your body, identify early warning signs, and sometimes prevent unnecessary surgeries. Where caution is required, particularly for elderly people and especially those with even mild kidney difficulties, is when contrast dye is added for clearer images. MRI contrast dye frequently contains gadolinium, a heavy metal. It doesn't remain stable in the body. It's designed for kidney elimination. But here's the catch: kidney function naturally decreases between ages 60 to 70. If you have chronic kidney disease or unrecognized impaired function, your body might not clear gadolinium as efficiently as usual. Small quantities could remain longer. This lingering can be hazardous. Gadolinium retention is linked to nephrogenic systemic fibrosis, NSF, a rare but significant disorder causing skin and connective tissues to stiffen and thicken. In severe manifestations, it can restrict mobility and breathing, potentially causing organ difficulties. Here's what most people don't know: retained gadolinium has also been discovered in brain tissue. Experts believe it may produce subtle neurological symptoms like confusion, dizziness, and disorientation, particularly in people already at risk for circulatory disorders. A 2019 Radiology Journal study followed over 2,000 people aged 65 plus who received contrast-enhanced MRI. Stroke-like symptoms, headaches, impaired vision, and balance issues were noted by approximately 5% within a week following treatment. While these weren't complete strokes, they were warning signs. Most of these patients had underlying kidney problems, detected or not. Harold, a 79-year-old Arizona veteran, sought medical attention for ongoing back pain with an MRI. His doctor mandated it be done with contrast, just to be safe. Harold wasn't aware his kidneys were weak. Nearly a week after scanning, he continued experiencing dizziness, weakness, and mental fogginess for 2 days. His primary care doctor performed lab tests, only then realizing he had stage 3 kidney disease. He told us, "No one warned me. I would have asked more questions if I'd known." Here's what you can do. If your doctor suggests contrast MRI, ask if it can be performed without contrast. Often, if contrast is absolutely required, request a kidney function test first. It's a straightforward blood test called GFR that can provide you and your doctor peace of mind. Also inform them if you've ever experienced unusual reactions to imaging tests. Remember, the MRI itself isn't the issue. It's the additional chemical your body might not process properly. With appropriate precautions, you can still get needed answers without endangering your kidneys or brain. Let's move to our final topic: a test appearing completely harmless and even beneficial to perform regularly, but might be leading elderly people toward potentially dangerous surgeries they didn't need. Routine carotid artery ultrasound involves no needles, dyes, or loud equipment, just minutes of completely non-invasive testing. Seems like the ideal preventive test, right? Here's what most people over 60 don't know. If you have no symptoms and your doctor is only ordering this scan for checking, this straightforward examination might lead you towards surgery you never needed. Carotid arteries are main blood vessels delivering blood to your brain. They can develop plaque over time, like many body vessels. Small calcium or cholesterol accumulations are very normal, especially as we age. However, not every plaque piece needs removal. Often, monitoring is wiser than operating. Here's where problems arise. Suppose you get the test showing some narrowing, perhaps 50% or 60%. Scary, right? Now your primary doctor refers you to a vascular surgeon, and suddenly you're told to consider procedures like carotid endarterectomy or stenting. But if you had no symptoms, no dizziness, vision abnormalities, or weakness, these procedures might not help you much. Plus, they're fraught with danger. A significant New England Journal of Medicine study monitored over 3,000 elderly people with moderate carotid narrowing but no symptoms. Researchers found surgery often didn't reduce stroke risk more than medication and lifestyle changes. Additionally, a small percentage of surgical patients actually had strokes as direct procedure results, either during surgery or recovery. Helen, 82, from Pennsylvania, has a story hitting close to home. She went for a checkup feeling totally well. Her doctor wanted to be thorough. She had a carotid ultrasound showing 65% narrowing. Surgery was performed within weeks. Unfortunately, she experienced a small stroke during the procedure. She survived but now has partial right-side weakness. She told us, "I wish I'd known that doing nothing could have been safer." What should you do? If your doctor recommends carotid ultrasound when you have no symptoms, ask, "What are we looking for, and what happens if we find it?" Make sure you understand whether scanning will change your treatment or just cause concern. If you're already taking blood pressure and cholesterol medications and living healthily, further tests might not make much difference. Don't worry if you've already had scans showing some narrowing. Instead of rushing into surgery, investigate repeat scan possibilities. Always get second opinions before any vascular surgery. In conclusion, let me provide helpful guidance and a gentle reminder that health responsibility lies with you. Here's the bottom line. Some tests are safer than others, but some aren't required. Our bodies react differently, particularly after 60. Things appearing ordinary, contrast dye, sedation, or scans, can have consequences we don't anticipate. A simple injection might spike blood pressure. Reactions could be triggered during scanning. Even simple examinations can involve risks potentially harming already vulnerable systems. That's why pausing, asking questions, and ensuring each test fits your specific health requirements rather than just following checklists or protocols is important. Don't hesitate to speak up. Ask, "Is this really necessary? Can we investigate safer alternatives?" Your medical history matters. Your opinion matters. Informed decisions lead to better outcomes and peace of mind. We believe every decision should be based on knowledge, not fear or routine. Comment 1. If you've ever experienced strange sensations after scans or tests, or witnessed loved ones experience something unexpected. Otherwise, comment 0. Let's share, connect, and educate each other. If watching this video made you feel more conscious, in control, or curious, subscribe to the Longevity Clinic. If you're watching right now, let me know you agree. Comment 1 if this video resonates, or 0 if not. We're here to uncover truth, ask challenging questions, and always put your health first.